Did you know that chronic stress could potentially lead to cancer? It's a startling connection that many people aren't aware of. Today, we're going to explore the fascinating link between stress, cortisol, and cancer development. I'm Dr. Sarah Thompson, and as a traditional medicine practitioner, I'm here to shed light on this crucial health topic. Let's start by busting a common myth. Stress is just a mental state. In reality, stress has profound physical effects on our bodies, and one of the key players in this process is cortisol, often called the stress hormone. When we experience stress, our adrenal glands release cortisol, which is meant to help us deal with short-term threats. But what happens when stress becomes chronic? Imagine your body as a finely tuned machine. Cortisol is like the oil that keeps everything running smoothly during stressful situations. However, when stress becomes constant, it's as if we're flooding the engine with too much oil. This excess cortisol can wreak havoc on our bodies, potentially paving the way for serious health issues, including cancer. Now, you might be wondering, how exactly does cortisol contribute to cancer development? Well, it's not a direct cause and effect relationship, but rather a complex interplay of factors. Cortisol, when chronically elevated, can suppress our immune system. Think of your immune system as your body's personal army, constantly on the lookout for abnormal cells that could become cancerous. When this army is weakened by excess cortisol, it's less effective at identifying and eliminating these potential threats. But that's not all. Cortisol can also increase inflammation in the body. While some inflammation is necessary for healing, chronic inflammation can create an environment where cancer cells are more likely to thrive. It's like providing fertile soil for seeds of disease to grow. Let's consider a real-life example. Sarah, a 45-year-old executive, had been under intense work pressure for years. She rarely took time off, worked long hours, and constantly worried about deadlines. Over time, she noticed she was getting sick more often and felt constantly fatigued. Little did she know, her chronic stress was silently affecting her health at a cellular level. Now, before you start panicking about every stressful situation in your life, remember that not all stress leads to cancer. Our bodies are remarkably resilient. The key is understanding the difference between acute stress, like the kind you feel before a big presentation, and chronic stress that persists for months or years. So, what can we do to break this potential stress-cancer connection? First, it's crucial to recognize the signs of chronic stress in your life. Are you constantly feeling overwhelmed? Having trouble sleeping? Experiencing frequent headaches or digestive issues? These could be your body's way of telling you it's time to make some changes. Implementing stress reduction techniques can make a world of difference. Regular exercise, for instance, not only helps reduce stress, but also boosts your immune system. Meditation and mindfulness practices have been shown to lower cortisol levels and promote overall well-being. Even simple deep breathing exercises can help activate your body's relaxation response, countering the effects of stress. Another important aspect is maintaining a healthy lifestyle. A balanced diet rich in antioxidants can help combat the oxidative stress that chronic cortisol exposure can cause. Getting adequate sleep is also crucial, as it allows your body to repair and regenerate. Remember, stress management isn't just about feeling better mentally, it's about protecting your physical health too. By taking steps to reduce chronic stress, you're not only improving your quality of life, but potentially reducing your risk of various health issues, including cancer. As we wrap up, I want to emphasize that while the connection between stress and cancer is significant, it's not a guaranteed outcome. Our bodies have incredible healing capabilities, and by taking proactive steps to manage stress, we can support our overall health and well-being. I encourage you to reflect on the stress levels in your own life. Are there areas where you can make positive changes? Small steps can lead to big improvements in your health. If you're concerned about chronic stress or its potential impacts, don't hesitate to reach out to a healthcare professional for personalized advice. Remember, your health is in your hands. By understanding the cortisol connection and taking action to manage stress, you're empowering yourself to live a healthier, more balanced life. Take care of yourself, and thank you for joining me on this important health journey.